My next guest is colorectal surgeon with St. Peter's Health in Helena, Dr. Emily Bubbers. Welcome, Dr. Bubbers.
Thank you.
Earlier we were talking about urinary incontinence, but I know that there's folks that suffer from rectal or fecal incontinence. Can you tell us a little bit more about what that is?
So fecal incontinence is the lack of control of either air or flatus or stool. And it can be minor to once every couple of weeks, or it can be severe up to multiple times a day.
Okay, so can you tell us a little bit about what causes fecal incontinence?
The causes are many.
Okay.
The most common time we see this are in older women who have had vaginal deliveries with tears during that time. Radiation to the area can cause damage. Surgery in the area, anal and rectal surgery, can cause damage. Anything that can cause nerve damage, like strokes or back pain or diabetes, can also have an effect on continence.
Oh, okay. So is rectal discharge a form of fecal incontinence, or is that something totally different?
It's usually different. If you're having rectal discharge, we usually have to look for the reason for that.
Okay.
When we talk about fecal incontinence, we're usually talking more about stool.
Okay. So that's one thing that a person can really help differentiate when they're talking to you, whether it's stool or something else.
Yeah.
Okay. So how do you actually treat fecal incontinence, or can it be treated?
It's absolutely treatable. The first step is to see a physician.
Okay.
Number one is we take a long history about your stooling habits, your stool consistency, diet, your history, your medical history.
Okay.
Any surgical history, and again, for women, gynecologic history. Okay. From there, we examine the patient in the exam room to do an anal rectal exam to look at tone, anatomy. A lot of times a patient should be up to date on their colonoscopy to make sure we're not missing any underlying cause for diarrhea.
Okay.
And then from there, we start a systematic workup through treating fecal incontinence.
Okay. One thing you mentioned was dietary issues. Can you explain a little bit more about how that affects incontinence?
So if you have fecal incontinence, it's much easier to be incontinent to liquid stool than solid stool.
Okay.
So a lot of patients have food intolerances that cause diarrhea.
Mm.
So identifying food triggers that can make your diarrhea worse is important, so those can be eliminated.
Okay.
Potential food allergies are important. And then fiber is a big part of any diet. So if you are not on fiber supplements, potentially adding those to help bulk up your stool.
Oh, okay, great. So I know a lot of people don't like talking about this, but it's important. And so really, how common is fecal incontinence?
It's probably more important than we know because
Okay.
people don't want to talk about it. It's hard to give a number.
Okay.
But again, it drastically affects somebody's quality of life, because if you're afraid of soiling your pants when you leave the house, you're going to be much more isolated. You're not going to go out to dinner. You're not going to go to birthday parties. So I think it affects women much more than men because of our gynecologic history.
Okay.
But again, if men have had surgery to the area, they can suffer from this as well.
Okay, so mostly women, but can affect men as well. Okay. And then you also earlier talked about uncontrollable flatulence. Is that also considered a form of fecal incontinence, or is that something totally different?
It's a lesser form because it won't necessarily ruin your clothing, but it can be quite embarrassing.
Right.
So it has less of a toll on patients, I would say, than stool.
Okay.
But it can definitely have an effect. And again, that we look at diet, and there are medications to control that.
Okay, so they might be able to help. Is there any other treatments that you can think of for that problem?
That is less. There are some minor procedures potentially out there, but that's less fixable from a surgical perspective.
Okay, so mostly diet and potentially some medication changes. Okay, so if you could give the readers or the listeners out there one message about this, what would be your take home to people that are watching this show about this issue?
So fecal incontinence is definitely more common. You're not alone. There are potential fixes, basic as adjusting your diet, adding fiber, and seeing a physical therapist. Okay. And if those don't work, we have other options, including sacral nerve stimulation. There are new devices on the market for artificial bowel sphincters.
Oh, wow.
That most people hear fecal incontinence say, oh, I'm going to need a colostomy bag. And that's no longer the ultimate truth anymore. So there are options out there. I would say don't suffer alone and come in and be seen so we can talk through it.
So a lot of the treatments that you were mentioning, are those available locally, or would you have to go to a big center for some of that kind of care?
Sacral nerve stimulation is present here in Montana, not in Helena. Some of the bigger operations you do need to leave the state for.
Okay.
But the majority of patients respond extremely well to diet modification, fiber, and then physical therapy.
Okay, perfect. So take home is don't let the embarrassment or issues of not wanting to talk about it stop you. Go in and see your doctor.
Correct.
Okay, well, thanks so much for the great information, Dr. Bubbers.
You're welcome.
Up next, you'll learn how physical therapy can help you gain control of incontinence. Stay with us.